This is going to be a pretty safe space, so feel free to ask questions. And what we are hoping that you will go away with a bit of new information and insight. But what this session today wouldn't be doing would be, we wouldn't be able to diagnose whether a person has an addiction or not. But we will give you shed some lights with regard to addictions in general, what causes it, what are some of the impacts. And then we have a series of addictions forums that's coming up in the next few weeks. Right. So the other thing is, if you do have a question and we are in the middle of sharing, you can feel free to type this your questions into the chat box, which you can also, if you have thought about something and you feel like writing it down, you can also write your comments in the chat box. At appropriate times, our colleague Liana, she will be compiling these questions, and Gaia and I will be responding to them, maybe in between or towards the end of the forum. All right. Okay, so like we were sharing, these are some of our addiction series that are coming up. So today is the 12th of October. It's an overview of understanding addictions. On the 19th of October, we'll be having behavioral addictions, and then 26th on chemical addictions. And then on the 9th and 11th of November, we will have a workshop that is a concurrent over 2 weeks on managing addictive behaviors in youth and then in adults. Okay, so do stay tuned and sign up if you are interested in attending any of these series. Okay, so for today, what we are going to do, very thankful that you have shared with us what you are interested in learning, and we are very thankful also that we managed to, we think we will be able to cover most of what you are hoping to achieve. Okay, so first of all, we're going to talk a little bit about what exactly is addictions, prevalence, how common that is, what are some of the risk factors for addiction, impact on the self as well as the family, and as well as the last part is the tips for how do we manage addictions. Okay, so we're going to start now. Okay, so what exactly is addictions? So addictions is actually a treatable condition. Very important to know that. And it is a chronic relapsing brain disease involving complex interactions among brain circuits, genetics, environment, and an individual's life experience. So these areas come together and interact in such a way to eventually affect and result in addictions. And people with addiction sometimes use a substance or engage in certain kind of behaviors that become quite compulsive over time and will continue even if there's harmful consequences. So there are prevention efforts and treatment approaches for addictions, and they are usually successful if the person with addictions follows through it and is as successful as other chronic diseases like asthma, hypertension, or diabetes. Okay, so addictions, how do you actually know that it's an addiction? Usually the person with addictions will be quite preoccupied with the addiction. And the second thing that you might want to find out will be that they'll be very interested in trying to get access to that thing that they're addicted to. Okay, be it maybe they really want to, if they are addicted to cigarettes, then they will be very interested in finding out ways to get more and more access to the cigarettes. Okay, and sometimes the extent of it can be resulting in sacrificing of personal relationships and responsibilities so that they can continue to pursue a high. And there can be some level of unease when they cannot get that high. And the high continues even if there's negative consequences both to self, maybe in health, mental health, physical health, etc., or to the family around them. Okay, all right. So the types of addictions, there are two types in general. We classify them generally. The first one is behavioral. Some examples you all have also mentioned just now will be gambling, eating addictions, cyber, gaming, sex and shopping addiction. And if it's chemical, it will be like drugs, alcohol, smoking, or prescription drugs addictions. All right. Okay, Gaia?
Yeah. So in this part, I'm just going to talk a bit about like how widespread addictions usually are. I think we have covered a bit about like what addiction here is, but in a sense, right, my own personal opinion is that we don't really talk much about addiction, for instance, and I'm not sure as to whether do we have an idea about how widespread this is lah. So I did a bit of research to actually find out a bit more. So what I had discovered here was that, for instance, when we talk about behavioral addiction, an example of that would be your pathological and gambling addiction, basically. According to a survey done by National Council on Problem Gambling, they have identified that about the gambling rate in itself among Singaporeans and permanent residents is about 0.9% in 2017. Okay, so this was a survey that they had done in the year 2017, and the rate was actually at about 0.9. Now, zero point 0.9 doesn't seem a lot, but if you were to look at it in the context of the total population of Singapore, we're talking about a large number here, right? So this is something that I was that made me wonder about what can we do more in regards to this. Yeah. Can I have next slide here? Okay, and so that is one example of a behavioral addiction, which is one of the common issues here in Singapore. The other types of addiction, that's also prevalent in itself would be drug abuse. And what the statistics drawn from CNB website actually shows here is that the proportion of new drug abusers as opposed to the total remains high at about 41%. Yeah. And the other would be that a lot of there's a high percentage of about 62% of the drug abusers being much younger, coming from a much younger age group, under the age of like about 30 years in that sense, 30 years old lah. Okay, so that's something that basically they have reported on. And another source from IMH, right? In 2016, they had done this mental health study, and what they have also shared was that 4.1% and 0.5% actually suffer from alcohol abuse and alcohol dependency in a sense, respectively at some point of their life. So, the statistics, if anything, I mean, it does point to the need for us to talk a bit more about it, for us to be open in actually having conversations about it as well. Okay, so which is why we have these series. I hope that you would, we could talk more, ask more questions, and learn more. Okay, now it's easier said than done. There are a lot of barriers, we acknowledge that. And I suppose there's a lot of preconceived notions about what addictions here, what addiction does to a person and what addiction is all about. Okay, so what I would like to do is to actually maybe run through a few things that I've, in my own encounters, have actually observed that people say about addiction. Okay, and I need your help here in participating in it also. Okay, so next slide.
Do you want to launch?
Yeah, so we would like to actually just ask you guys a few questions. There's a poll question there. Do select the answer that you think best answers the question. Yeah. So the first question here is one-time use of drugs will not get you addicted. Is it a yes or a no?
Yes, I see people participating already.
Okay.
So
All right.
we have almost 15
Then-
now who have actually participated. So let's wait a little while.
Okay, so about 64% of you guys say that it will not get you addicted, and about 36% of you guys say that it will get you addicted. Yeah. Okay, Ken, interesting.
Interesting.
Right.
All right. We have another poll.
So second question.
Second poll.
So the question here is, if someone uses willpower, they should be able to stop using drugs. So if someone uses willpower alone, maybe they should be able to stop using drugs. Is it a yes or a no?
Yes, I'm beginning to see people polling right now. Here we go. Half. Very interesting.
Neither here,
Very
neither there, right?
interesting. Okay, okay. So about 50%, I mean half.
Okay,
Okay.
all right.
Right. All right.
Okay, so one-time use will not get you addicted. Well, I can only speak of my experience. I have worked with people who have who have abused drugs, and what I do see here is that there are certain kinds of drugs that actually causes for a person to get to crave a bit more. And it kind of it also kind of actually changes the brain activity in that sense a lot lah, right? So example of drugs like that would be like, say for instance, cocaine lah, ketamine lah, methamphetamine in that sense, from my observation. Yeah, and what I see is that it does result in them actually feeling in feeling the euphoria, and so it makes them want to then recreate it a bit. Okay, so therefore I definitely would say that you introduce them into the process of getting addicted. okay, and therefore want to crave again for to consume these drugs again. Okay, so that's something that I have made notice of lah. Okay, um, so that's one thing. And the second myth here is that once an addict, always an addict. That is not true. Okay, because no matter at which stage of the spectrum you may be in and all that, it is always possible for a person to get treated to recover. Okay, what is important is that we use a very holistic approach to the treatment. Okay, the individual, the family, and as well as the treating team as well. Okay, so that's important. Yeah. The third myth here, the very common thing that people always say, if you just use willpower, should be able to stop it. But definitely not. I mean, I love coffee. I feel that I am definitely addicted to coffee. You ask me to quit coffee? No, I cannot. Okay. So in a sense whereby it is definitely more than just a willpower. And I would like to also emphasize that no one ever chooses to become an addict. It is not as simple as like exercising a choice, exercising like changing any part of their behavior in a sense to actually quit an addiction. It is much more than that. Like what I shared, it takes a holistic approach to actually change, or if not to recover from addiction. Okay. So that's something that I would like to just to emphasize on. And I suppose one of the prevalent thing here is that people tend to always see them in a very bad light, which is that the addicts are bad people. Like I think there was this person who shared about the usual thing here is that people tend to look at them from a very legal lens, right? Like a criminal legal type of a lens. Um, so from it is not the people but rather the behavior in that sense that we might need to address. And I think when we have this perspective that they are bad people, and all that, what I then am rather worried about is that would this then therefore put them in a place of being stigmatized even much more, or would that even make them want to shun away from getting treatment that they need to. So I think as a community and I suppose as a society, we might want to look at exactly how do we see addiction. And like I shared with you, this is one thing that's prevalent and one thing that there's a lot of stigma around it. And recovery in that sense, treatment is possible. Okay, it needs a lot of people to be involved in it. It needs a lot of people to also understand and accept that they need the help just as much as any other kinds of individuals who are facing other kinds of mental health issues. Yeah. So I think that's something that we would like to just emphasize a bit on now. Okay. Now, I suppose we have spoken a bit about how widespread it is and maybe what are some of the preconceived ideas about addiction. I'm just going to just going to touch on the diagnostic criteria for addiction. What what would, from a psychiatric standpoint of view, what kinds of criteria would qualify a person to have, rather to be diagnosed to have substance abuse or if not addiction in that sense. Okay. So from a psychiatric standpoint of view, usually if a person exhibits a maladaptive pattern of substances, and if this lasts for 12 months or sorts, then yes, and I suppose they do manifest 3 or more of the criteria that is set for substance abuse, then yes, it is said that they have, substance abuse addiction. Okay, the list of criteria is quite long and exhaustive. So what I'm going to do is to just summarize it, the pertinent things. So if we have a person who seems to be craving for a substance use, and there's a lot of preoccupation that they may have in wanting that substance, for instance. So say for instance, even if it's alcohol, for instance, okay, them wanting to actually drink a lot, and this in itself actually comes at the expense of their work, of having of socially relating with their friends or with their family in that sense, then that becomes a bit of an issue here. Okay, because in a sense whereby compared to their usual life, they are making certain accommodations to this habit, for instance. And suppose what I do observe is that a lot of them actually do say that even if they know that they are aware that a lot of people don't really like them drinking, for instance, they are aware that this is impacting their work, but then again, they cannot just stop it. They don't know how to stop it. They can't stop themselves in that sense, right? So that's usually the thing that a person with addiction might sometimes say. Okay. And you would also hear individual who has addiction also share that 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 they need to drink more otherwise, or if not, consume more drugs in order to experience the same level of highness in that sense. Okay, so in a sense, the tolerance in a way will gradually increase because they need to get to that level of high. Yeah. And of course, like what I shared, a lot of them do want to cut down but cannot. It is something that they have kind of lost that control over. And when that consumption is reduced, you would also see them experience a lot of withdrawal. All right, so that withdrawal can come in the form of like them just having cold sweats, for instance, and having some level of confusion in a way. All right, so we might want to look out for things like that, and depending on what they exhibit, we might then want to look at exactly what would be the appropriate support that we need to get for them, if we are in the position of being a caregiver and friends in that sense. Yeah, which is true. Okay, yeah. I think there are a lot of interesting comments from the chat. I think I definitely will want to address that. Let me just quickly run through this part. So I think earlier on I mentioned about the diagnostic criteria for substance addiction. So this is basically what is, there are 11 criteria, for instance, and a lot of them covered the ones that I had covered earlier. I mean, it's associated with preoccupation, for instance, associated with them making accommodation for it at the expense of their own at the expense of their own day-to-day things, routines in that sense. And then I suppose having withdrawal symptoms and increasing their having I suppose increasing their tolerance over time. Yeah. So if you're interested, you can, there are a lot of resources out there that actually looks into, that would clearly kind of that looks into the diagnostic criteria and explains a bit more lah. Okay, so yeah, next one. Okay. All right, so we have identified so far what is addiction about, why do we need to talk about it, the prevalence of it, for instance, the myths around it, surrounding it. Okay, so in this part, I'm just going to look into the risk factors for addiction. Now, something that I would like to note here is that some of these factors that are identified, it only makes an individual vulnerable to addiction. We're not saying that they will confirm plus chop, cause it. We're not saying that. But it's just to say that it might, make a person vulnerable. And of course, the other point that I would like to remind you that is that this is not meant to diagnose a person. It is only meant to kind of if you connect with some of the things, it's always important to just speak to a professional about it and get the appropriate support lah. Okay, so that's a disclaimer that I would like to make before I launch into this part. Okay, so risk factors, basically there are biological, physiological reasons, and as well as social reasons. Okay, so let's look at the biological reasons. What would be a biological reason that would explain a person to get a bit more vulnerable towards addiction? Now, what has been said in research here is that when a person is the process of addiction that that actually stimulates the brain reward system. And so when a person I suppose consume alcohol, for instance, or drugs in that sense, the brain kind of gets the brain reward system, which would be the dopamine and all that, it actually gets stimulated by that process of it, by the consumption of it. So when that happens, the brain feels good, and therefore, again, when that person in a way approaches a substance in that sense, it might actually make them want to crave for it. Okay, it might make them actually in a way connect with that experience of euphoria in that sense that they actually feel. So for that reason, that craving in a way makes it difficult for them to actually abstain from it, and therefore it actually makes them then want to look for it. I mean, rather at least again, once again, indulge in that experience of addiction in a sense. Okay, rather in indulging in that experience of consuming some of this substance again. Yeah. So
I think someone asked, what is a brain reward system?
So I'm just going to simplify this. It's in a sense whereby it is. So say for instance, it is like, say for instance, if you are consuming something. Okay. Let me just simplify this in a way. Imagine you're eating ice cream. Okay. So ice cream you eat and then you feel the taste of it. And when you feel the taste of it, what happens is that it makes you feel good. Your senses feel good. and all that, right? So then, therefore, what happens here is that the brain automatically connects this to a good memory, to a very pleasurable type of a memory of it. Okay, so then what? So therefore, because of that association, that strong association, for instance, imagine if again you were to walk past that ice cream shop or sorts, it would once again re-trigger those sensations, and make you want to go and crave for it, make you want to go and buy another. I mean, I suppose another ice cream of sorts. Okay, I'm simplifying this because I'm not going to go into the science of it too much. But if it helps, I think what I'm trying to say here is that it gives that sense of like pleasure, that sense of happiness, in that sense that people would want to actually experience when they consume this drugs. I mean, this substance basically. Yeah, I hope that's a bit more clearer in that sense. Yeah. So, okay. So that would be a biological reason as to why people might want to seek substance. Now, there are psychological reasons as well as to why people might want to actually seek, substances like, alcohol or even drugs and all that. For one thing, in a sense, is to actually self-regulate the psychological pain. So, if a person, say for instance, who may be experiencing some life transitional issues, maybe in a sense moved into a new country, not quite quite having much of a social support, not quite having I mean that not being able to adjust well. They might experience that low mood, or otherwise, there are also people and individuals who might be experiencing some level of anxiety, or depression, for instance. And maybe perhaps because of the difficulty that they have in not being able to cope, they might then turn to alcohol, for instance, or even drugs to actually help them to feel either high, more energized, or otherwise actually feel to manage this anxiety that they may be experiencing as well. Okay, so it is to actually there are individuals who use it to actually regulate their psychological pain, so that it helps them to cope with the day-to-day things. Okay, it actually helps them to be a bit more functional in a way. Okay, so that's one of the reasons. For some people, it could be because of their inadequate coping mechanism. So that can be a bit more observed in the youth, for instance, especially among the youth, because they're not quite well developed. Then it makes it difficult for them to actually then not be able to manage well enough. Yeah. And for instance, earlier drug use is also another factor. So if in case it's something that has started at an earlier age, right? They might once again go back to the same root. I mean, the same habit, in the sense, the same addiction type of behavior. Okay, to cope. Right. So those are factors in a sense that could make a person vulnerable. Okay. From a social cultural reason, one would be maybe easy access to substances. If I suppose you're, you're always in I mean, I suppose you are from a family where people alcohol consumption is very usual, it's very normal. Okay, then I suppose it might actually it might cause a person to want to experiment with drinking and all that. Okay, so that's one reason, for instance. And I suppose I suppose in the younger generation there are a lot of youth who might be addicted to using internet, to gaming, in that sense. I suppose I think one of the reasons here that makes it difficult for them to break that, or to even overcome that, is because of the access to gaming, for instance. Right. So therefore, these things can actually make it difficult for a person to kind of to manage the addiction. Okay, because of the easy access. So that's one thing. Now, social crisis issues, I think what I have read about is that sometimes when sometimes somewhere in the 1990s or early 1980s, especially in US, there was a lot of like economic crisis that was experienced in the city areas and all that. And what that saw was that a lot of people then turned towards addiction in a way to actually cope. So that's sometimes is a factor. Family history, like what I shared, if there's if I suppose there's a strong family history of being addicted to substance, being addicted to alcohol and all this, that can sometimes repeat itself in the generations that follow. Okay, so that would be, yeah. So those would be the reasons here. Yeah. So yeah, I mean, my colleague in that sense will explain a bit more on that commodity in that sense.
Yeah, so actually, comorbidity is when you have both chemical and behavioral addictions and mental illness together. It can happen because of the chemical alterations, or also certain pre-existing mental illness that can have happened and excavated. And addicts sometimes also replace one addiction with another. Like, for example, they will switch from one drug to another behavior to fill the void, for example, from giving up from drinking. So maybe they switch from a drug to drinking, or a drinking to another addiction behaviors. And also to help to avoid the emotional pain at the root of the addiction, actually, because a lot of times addiction starts when, which Gaia will talk a little bit more, will be that actually it starts off from certain difficulties in coping, resulting in use or behavior later on. All right.
Okay. There's a question. Are we able to can we
Yeah, yeah.
address questions in that sense? Okay, there's a question by Tan in that sense, and I thought that was an interesting question, really. Okay, if it is in the brain means cannot change addiction. Okay, so if I can maybe I suppose I think the question here is about if it is just biological, if this is, maybe because of this brain reward system, does it mean that it cannot be changed? Like what I shared, I think there are a lot of it's not just biological reasons, there are other reasons as well, like psychological and social reasons. That's one thing. But what that also implies here is that in treating a person with addiction, usually the treatment would encompass addressing the biological reasons as well. I mean, the biological factors maybe. Okay, and so therefore, which is why for a person who might be having substance-related kind of addiction, usually they would start with seeing a psychiatrist at NAMS, for instance. Okay, so then that's when the psychiatrist would actually look into prescribing some medications that will help them manage a bit. Okay, and then after which it would then proceed on to like actually the more psychosocial type of intervention, where you would have counselors, psychologists, and all that, or even social workers working with them to address some of these issues that perpetuates addiction, or if not, contributes to it. Yeah. So in a sense, whereby the treatment is usually very holistic, especially for substance abuse types of addiction. Okay, so this is something that I've seen in a sense. Okay. So, but again, I think I'd like to go back to what I shared. Treatment is always possible. It's always possible, even at whichever stage of addiction you may be, that that the appropriate resources be sought, and that professional help be sought after lah. Okay.
And also, Gaia, there are some medication, there are some medications that can act as barriers, meaning that they can actually block the drugs from reaching the brain. Yeah, so, but these medications are not 100% foolproof, but there are some ways that, I mean, the best thing that we will advise is to seek treatment. But these are some information for you to consider as well.
Yeah, yeah. So yes, I mean, I would echo what Pei had shared. And it's always important that we get professional help. I think just so that that the person can get the support that they can get at the right moment. Yeah. Okay, so let me just share a bit about the process of getting addicted, and how does it even start in the first place. Okay. So basically, the first stage, what usually happens is that sometimes the individual might just be instigated a bit by curiosity. Maybe they might want to know exactly how does it feel like to smoke, for instance. Okay, how does it, how does it feel like, and all that. So it starts with being them wanting to just experiment with it, and that gradually sometimes can progress on to them feeling that they need to perhaps smoke in order to feel less anxious. Okay, so this is where it just proceeds on to them, like I suppose, like like using that habit in order to be able to function. Okay, so this is the progression that sometimes can happen. in that addiction spectrum here. Okay, and I suppose if this progresses on, there's no like real discontinuation of it. What then happens is that it becomes more of a habitual type of thing. Okay, where they might need to like adjust. I mean, I suppose some areas of their life might then get affected because of this habit. So say for instance, like like them maybe if it's about alcohol, for instance, or even gaming, for instance. Okay, you might have like individuals maybe spending a lot of time on gaming, and therefore not going to school, for instance. Or individuals like in a sense spending a lot of time on like drinking and therefore not going to school, or was still even like having a lot of like their loved ones, their relatives feel very frustrated with them as well. Okay, so these are the areas in which it would get affected. If this progresses on, then that would just lead to dependency, which is that it just makes them want to increase the level, increase the consumption of these substances. And if there's any reduction or even like a stop to it, okay, they might then have a lot of withdrawal symptoms and all this. Okay, and of course progressively, in the sense that in itself will actually lead to what we call addiction in a way lah. Okay, so this is the process that happens when a person gets addicted. So which is why it always helps. It makes it much more easier if like say if this thing can be nipped at the bud in a way. Yeah. So that's the thing that I would like to just share with.
Okay, so now we are on to the part about impact on the individuals who have addictions. So there are a few major parts. First one is about mental health. So when the addictions, especially for chemical addictions, when too much is also taken, sometimes it can be vulnerable to psychotic disorders, mental and behavioral problems, and it can also worsen depression or may lead to psychiatric illnesses such as traumatic stress disorder, forms of anxieties, and as well as phobias. So in terms of general health, right, for example, for alcohol abuse, there will be liver damage. For tobacco abuse, maybe have lung cancer. Drug abuse could have some damages to the nervous systems. And also alcohol and tobacco users are also at greater risk of developing cancer. So these are some indicators, but they don't mean that it definitely will happen. It is just certain impacts that may result in mental health or medical issues. And also, I think larger than that, people with addictions often have much more social difficulties as well. But perhaps they may experience social isolation or withdrawal because they are very focused or obsessed with the substance or addictive behaviors, causing them to put all their mind on either the substance or the behaviors. And sometimes because of the intoxication, right? For example, if they have drank excessive amount of alcohol or taken excessive amount of drugs, etc., they may result in risk-taking behaviors, and then those risk-taking behaviors can exhibit themselves in violence. Perhaps like reckless driving or reckless sexual behavior, perhaps domestic violence, and then accidents and injuries. They could also, as a result of these reckless acts, end up having problems with the law because of intoxication usually. And then after intoxication, there's impaired judgment. So this also end up becoming difficulties with the result of the law, which like one of the participants has mentioned earlier, yes, is what we often see in the news as well, right? And I think one of the impact is also that people with addictions often call out sick because they may not feel very well over time. So if that happens over a significant period of time, there might also be a loss of employment. And with the loss of employment, sometimes there's a loss of income to supplement that addictions that they may have, causing perhaps other issues, like they may find other ways to try to get that, to feed off their addictions. So this cycle kind of goes round in some ways, all right? So the impact can both be mental, social, as well as physical and medical. I think some of you will be will find this relatable to you. There is also, of course, impact on partner. I think if you're a partner of someone with addictions, one of the things will be a lot of frustration as well, because maybe perhaps like one of you said, actually it's very hard to get the person to take responsibility or even to stop taking the drug or stopping their behavior or addicted behaviors. So it may lead to disappointment, strained relationships, or to for people who are marriages, maybe divorce. Also fosters mistrust in relationships because certain times addicts may lie about their habits or behaviors, perhaps not because they may want to lie, but because maybe they know that it causes hurt and disappointment, so they kind of goes into a cycle. Medically, there could be potential implications of certain drug use, like could be infertility and may affect intimate relationship, and as a result, instigate certain jealousy, violence, domestic abuse, etc. So one of the other impacts is that when a person who has addictions, there's a lot of focus on trying to get access to the drug or access to continuing with that behavior. And then as a result, they don't really focus very much on other aspects of life for functioning. So what happens is maybe if there's a partner at home, they will have to hold on to unfair shares of household responsibilities, childcare, taking care of the family members, etc. So perhaps that's also causes a resentment as well. But on the other spectrum, sometimes partners of addicts, right, may also have this thing called a codependency, meaning that sometimes the partners will find reasons for, oh, because this person is this way, therefore he's taking drugs, therefore he's behaving this way, kind of like explaining away the behavior, even if it's detrimental to the person's well-being, meaning that if I'm a partner and I'm trying to explain away why the addict is doing this, even though it is affecting me as a person. Or they may deny severity of addict's problems and try to defend the addict as well, right? And it's a very difficult to it's quite difficult for people, for the partner, because they kind of, there's a dissonance as well. On one hand, you know the addict should stop the behavior. On the other hand, we're trying to defend them because of love and concern for the addict. So sometimes that experience can be very disorientating and also disappointing for the partner. Right. So the other impact that we want to highlight is also the impact on children. When if there are both parents are affected by affected by addiction, then sometimes it's very hard to figure out whether the parent is sober or intoxicated. So this causes a very unstable environment for children. So sometimes children have to fend for themselves. So if you have seen children from families where there are addictions, where they don't have 3 meals that's given to them, or they have to figure out how to get their meals when they're hungry. Some of them learn how to cook, or and get hurt in the process when they're trying to cook because they're too young. So some of them don't go to school because there's no one to kind of like create that structure for them. Some children we have known is also they will be exposed to illegal activities, for example, being asked to pass drugs to other people, or being asked to kind of like lie on behalf of their parents who are maybe using drugs. And certain children, if the parents are arrested due to drug use or other addictions, may end up becoming raised by grandparents or relatives, so like the skip generation children. And some of them may actually be experiencing physical or emotional abuse, because sometimes when, especially when a parent is intoxicated, that intoxicated behavior may result in certain levels of abuse. So the impact of children cannot be undermined as well lah. Okay, so tips for recovery, Gaia?
Okay, I'm just going to go through a few tips for recovery. Now, this is just an introduction in a sense. There are upcoming workshops and I suppose forums that will be available. Subsequently in a sense, okay, that could offer more tips for how a person could recover or rather manage addiction. Okay, but generally in a sense, what helps is for the person with addiction to actually recognize symptoms in a sense. All right, so to be able to recognize that if in case if you observe that there are in a sense, maybe that you see that you are increasing consumption of a substance in that sense, and that you find yourself experiencing a withdrawal. All right, so then it's to actually recognize that maybe perhaps there is that you could possibly be having some level or experiencing some level of addiction in a sense, or dependency on a substance. So recognizing symptoms helps. And I suppose after you recognize, then it would then be important to educate yourself, to know exactly what is addiction all about, what is this about, and therefore how to then manage it. So just because, like what I shared, just because a person becomes addicted, then that's it. The person becomes an addict for the rest of their life. That doesn't help. I mean, that's not usually the case. All right, recovery is always possible. What is important is to get the right kind of support, to get the right kind of information. Yeah. Third thing that's important that helps is to get support from friends or family. I think a lot of individuals who experience addiction is that they feel that they need to do this on their own, and if like they tell this to their friends or family, then that's it. They are going to make them worry. Then or otherwise, they just fear what might they think about them, right? About what their loved one might actually think about them. So yes, I mean it's not easy. I mean it's not an easy conversation to have for sure, because of the fact that I think there's a lot of rather negative stigma kind of thing that actually goes around this issue. But what helps is to actually to manage this with the support of friends and family lah. Okay, that's something that I like to just emphasize on. Counseling as well for relapse prevention and some of this underlying issue helps. So, for instance, if there is so counselors, what they do a fantastic job on is a lot to do with. I mean, is basically is helping a person with relapse prevention. Okay, and how to actually help them to know how to manage their behavior, for instance. So counseling to address that helps. And of course, if for instance a person is like maybe is turning towards addiction because they're feeling depressed or they're feeling anxious, then counseling in the sense to actually help manage that also supports them in their recovery. Okay, so that those are the few tips in that sense to actually help a person with addiction actually recover. Yeah.
Tips for families and loved ones. So I think Tan, you have actually raised this question at a great time. So one of the most important thing is that you can help educate yourself about the addiction and understand the behavior. It's quite important to show and divide, kind of like separate the behavior from the person. That means the behavior is a gambling behavior, but it's not that the person is the problem, the behavior is the problem. So it's very important to differentiate that and understand that, because that will determine how you will respond to the person who is addicted. It does help to educate yourself a little bit about the addictions, and also perhaps also the difficulties in getting that off. One of the things that we also found very helpful is showing that you really care. For example, understanding that this is something that understanding their struggles, if they do have any signs of consideration of not, wanting to get off this drug or behavior, and show your understanding towards understanding what situation or difficulties they may be coping with their life. Because sometimes when we try to say, when we try to nag at them, or we try to tell them please stop, they may interpret this as, hey, why are you criticizing me? Actually this is not a problem, my boss is the problem, my other issues in my life is the problem. So sometimes it may counteract your good intentions. So this one is actually quite one of the ways that we have found to be extremely helpful. um, Set rules and boundaries. I think if people are willing to, if the persons with addictions are willing to sit down and think about it, you can set rules in incremental ways. I think cold turkey will be very difficult. You cannot say tomorrow just stop gambling immediately, or tomorrow complete off certain drugs, because that experience will be very painful for the person with addictions. So one of the ways, for example, somebody said if there is addictions to cyber or computer, one of the ways is maybe you can put a computer in the living room where everybody can watch what it's doing, so that you can kind of remind in a gentle way, hey, time off from the computer. Or you can set maybe every single day you will kind of scale down from maybe 10 hours to 8 hours to 6 hours, etc. So certain settings, certain rules and boundaries, but also an agreement with the person with the addiction, so that they don't feel that you are kind of taking this away as a punishment, or that you're criticizing them as a person. But of course, when you are doing all these things, have realistic experience, sometimes it may be very difficult. So maybe they will go into a period where they will still not meet the expectation or the boundaries. But that is an opportunity to show that you care. Or if it's too difficult to change, perhaps it's time also for them to go into treatment. But of course, take care of yourself, get support from other members of the family, or if you need counseling yourself, you can also go for counseling. It's not counseling is not only limited to the person has addiction. It can also be for people who require help to know how to support the persons with addiction. And the last part is don't enable. So it's easier said than done, but don't rescue the addict. let them experience some consequences of the addictions, because only when certain consequences are experienced, then there might be some reconsiderations or entry points for consideration to change. Yeah, right. Okay, so just now I think someone also asked about what are some resources, whether they are confidential, and whether there are treatment options. So of course, Viria has an option for Viria Therapy Center. This is our information. You can also go to Alcoholics Anonymous, and Al-Anon family groups for families. Then there's also what Gaia has also mentioned, the NAMS, and We Care Community Services and Promises Healthcare, right? So these are addictions resources. There are also other helplines that if you require, they will also be very helpful to call for help. The National Care Helpline. We also have a counseling hotline. You can also go to Singapore Association of Mental Health. These are certain areas of support that you might want to just consider getting help, and they are confidential. Okay. Yeah. So anything you want to add on before we go into Q&A, Gaia?
I think that's about it, but I think there are interesting questions in the Q&A that we would definitely like to address. So yeah,
Yeah.
it's good on my end.
Okay. Okay. The first question is, what will be taught in the workshops and how are they different from the earlier forums? First of all, it will be more in depth, and you will get a bit more time with the facilitator, and you will be able to bring up your specific questions pertaining to your situation. So the youth workshop are for parents of youth affected by the addictions, and looking into understanding addictive behavior in terms of your youth, acquiring the basic skills to identify addictive behavior and how to respond, how do you support your youth, managing your emotional and psychological needs. So they are in details. And for the adult workshop, it is for families who have adult members suffering from addictions. And the focus is on understanding and recognizing addictive behaviors in adults, the emotional and psychological impact behind the addictive behaviors, and developing coping strategies, and to manage your own emotions. So all of them, today what we have done is to give an overview, but the workshops itself will give you an opportunity to go more in depth. Right. Okay. Second question, is repeated thinking about something counted as an addiction?
Can I address that?
Okay.
Well, it's a bit complex because we have got other kinds of mental health conditions that actually cause for a person to repeatedly to ruminate in that sense, right? An example of that would be, for instance, would be OCD. I mean, obsessive compulsive disorder. So if a person keeps ruminating about wanting to, check their doors or sorts, right? So that it is different in that sense that the experience of that condition would be a bit different compared to addiction in that sense. So therefore, whichever the case is, if you feel that some of this information that we shared seems to connect with you, and you're kind of like wondering about perhaps whether might you be like experiencing some kind of like a mental health issue, you're curious about it, or you know of a loved one that might be experiencing a mental health issue or sorts, I would really like to recommend that that you seek professional help. Do either go to do seek either go to a psychologist in that sense, or even the nearest doctor in that sense, so that they can help you get the proper diagnosis. Because there's a lot of information that's out there, and sometimes it's always important that we kind of get go to the appropriate sources, right, to get the proper support that we need to lah. Okay, so that's something that I think I like to just emphasize on also. Okay. um okay, so there's a third question about heavy phone use by children. Is that considered addiction? Can it be treated? I suppose it depends on how, when we say heavy phone use, how extensive, what's the experience of that. So I think earlier on when we spoke about addiction, there are certain behavior traits that actually accompanies with addiction, right? So one would be that for one thing, they make it, they know that that this is wrong. For instance, this cannot, but then you would explain, you would hear them saying things like they cannot help it but to, I don't know, use it or whatever. or there's a lot of them actually using it, getting very preoccupied that they must use it, right? Using it for increased number of hours, and that comes at the expense of them neglecting a lot of things, not eating in that sense, sometimes not even going to school, skipping school, doing a lot of things like that. And if, like, say for instance, like they are away from it, then it just it's a change that they may not be able to adapt to, or may not be able to accommodate in that sense. So perhaps that can be, so if these traits or these behavior is something that's noticed, then it might be helpful to speak to a nearest to a counselor that's near, to nearest to where you stay, to then look at exactly what would be the options lah, okay, that you could consider to actually get the support for your child. Yeah, all right. And can it be treated? Yes, of course, for sure. I mean, it like I shared with you, treatment is always possible. It is important that the individual, is involved in it. The family, in that sense, is involved in it. Okay, as well as the professionals, in that sense, are also involved in it to actually help this person recover from any kind of addiction issue. Yeah. Do you
Okay.
have anything to add in that sense?
I think there was another question as well, regarding whether if they seek treatment, will they actually be reported to the police? It depends on the organization's policy. So if you are seeking treatment, it will be helpful to ask this ahead of time before you take the
I think
treatment.
it's important, as a service user, to actually check in with, like what Pei had shared, check in with what, on what's their standpoint, and stand on matters like that. And I suppose if, say for instance, a person is feeling that they may have a setback, then how can they then actually work well with the counselor who's treating them, for instance, in managing the setback. It's always good to have such open conversations. So I think that's something that I would recommend. Yeah.
Mm.
I think there was possibly I don't know if it was a question or a comment, but it was about something about, families themselves actually might be facing some difficulty in actually supporting in the first place, right? So I mean, I suppose if this is, if I think from a standpoint of view of a caregiver, yes, it definitely is difficult. It's very frustrating in that sense. I think what we would like to advocate for is that seek support. I think seek, support of professionals in that sense, and seek the support of, like, other family members who might be able to, like, journey this with you, and do, um, and I suppose, like, it's important to help the person with addiction manage, but at the same time it's also important for yourself as a caregiver to look into your own needs as well. And it's also important to actually remind yourself that beyond this addiction and all that, there's also other aspects of your life that requires equal attention and time as well. Okay. It's not easy for sure. I think I've seen in my own experiences that caregivers really get very frustrated, and they get very burnt out very easily, because the person is still there, right? I mean, it's just there, but then again, sometimes just, because of the behavior, it's difficult in that sense to actually manage. And sometimes it's also about the change in the behavior that makes them not not be too, not be too clear about how to manage, right? This new person that they may be seeing. So it's not easy. I would suggest that, you know surround yourself with support, at the same time identify aspects of your life that's actually working out well, so that you can get the strength to actually manage some of these difficult things, emotions that you might be facing as well lah. Okay, so that's
Mm.
something that I think I would like to just share.
Yep.
Yeah.
Yeah, take care of yourself,
Yes.
right? Okay, so we have come to the end of the workshop. So remember, if you do have more in-depth question, you can either sign up for the workshops that are more in detail, or you can sign up for upcoming sessions, which is behavioral addictions and also chemical addictions, which are coming up in the next 2 weeks, right? So in those situations, we will share more in depth, right? Okay. So before we finish, if I could get your help to scan in this QR code, also to or you oops sorry to also use this link to give us your feedback on what you thought about today's session. That would be we will really appreciate that.
Thank you so much for being here, really.